नमस्ते बिटिया, हमेशा खुश रहो बिटिया। I am Dr. Bharat Sharma, Assistant Professor, Department of Pathology, Faculty of Homeopathic Science, JAYOTI VIDYAPEETH, Women's University, Jaipur. Today's topic is Angina Pectoris. Angina pectoris is a clinical syndrome of ischemic heart disease resulting from transient myocardial ischemia. It is characterized by paroxysmal pain in the substernal or precordial region of the chest, which is aggravated by an increase in the demand of the heart and relieved by a decreases in the work of the heart. There are three overlapping clinical patterns of angina pectoris with some differences in their pathogenesis. First is stable or typical angina. Second is prinzmetal variant angina. Third is unstable or crescendo angina. Now first we are going to learn about stable or typical angina. This is the most common pattern. Stable or typical angina is characterized by attacks of pain following physical exertion or emotional excitement and is relieved by rest. The pathogenesis of condition lies in chronic stenosing coronary atherosclerosis that cannot perfuse the myocardium adequately when the workload on the heart increases. During the attacks, there is depression of ST segment in the ECG due to poor perfusion of the subendocardial region of the left ventricle, but there is no elevation of enzymes in the blood as there is no irreversible myocardial injury. Second is Prinzmetal's variant angina. This pattern of angina is characterized by pain at rest and has no relationship with physical activity. The exact pathogenesis of Prinzmetal's angina is still not known. It may occur due to sudden vasospasm of a coronary trunk or induced by coronary atherosclerosis, or may be due to release of humoral vasoconstrictors by mast cells in the coronary adventitia. ECG shows ST segment elevation due to transmural ischemia. These patients respond well to vasodilators like nitroglycerin. Now the last one is unstable or crescendo angina, also referred as pre-infarction angina or acute coronary insufficiency. This is the most serious pattern of angina. It is characterized by more frequent onset of pain of prolonged duration and occurring often at rest. It is thus indicative of impending acute myocardial infarction. Distinction is thus indicative of an impending acute myocardial infarction. Distinction between unstable angina and acute myocardial infarction is made by ST segment changes on ECG. Acute myocardial infarction characterized by ST segment elevation, while unstable angina may have non-ST segment elevation myocardial infarction. Multiple factors are involved in the pathogenesis of unstable angina, which includes stenosing coronary atherosclerosis, complicated coronary plaques, that is superimposed thrombosis, hemorrhage, rupture, ulceration, etc. Platelet thrombi over atherosclerotic plaque and vasospasm of coronary arteries. More often, the lesions lies in a branch of the major coronary trunk so that collateral prevent infarction. This session is powered by Digital Version 2.0, Jyoti Vidyapeeth Women's University. I hope you all enjoy this session. If you have any query, please mention it in comment box. Thank you.